Hello, this is Dr. Heilig, orthopedic surgeon with Assured Orthopedics. I am going to talk to you today about knee replacement and what to expect. Um, there are a few reasons for knee replacement. The number one by far being osteoarthritis, which is the most common form of arthritis, typically due to just wear and tear. Um, You can do it for rheumatoid arthritis. The results aren't as good. There does tend to be more residual stiffness with rheumatoid arthritis and knee replacement. Deformity. Some patients have severe bow legs or knock knees, which is a varus or valgus deformity that can require knee replacement. And then post-traumatic arthritis, if you've had a bad injury to your knee, whether it be with sports, work injury, car accident, whatever, it can set up arthritis in the knee over time. Um, Typically, knee replacement is only after you've exhausted non-operative treatments such as injectables like cortisone and hyaluronates like Synvisc, therapy, bracing, anti-inflammatories, activity modifications. Um, Things to know before surgery is nothing to eat or drink for about 8 hours prior to surgery. You should plan on using assistive devices for 3 months minimum after surgery. This would include brace, walker, crutches, cane. Um, Good nutrition is important to prevent uh, wound breakdown. It promotes the healing and gives you a better result. You want to avoid smoking. Once again, you can get wound breakdown with smoking, and once again, poor results. Uh, Risks associated with knee replacement have been reported as high as 11% incidence. These include infection, loosening, meaning the components not adhering to the bone, blood clot, which can potentially be fatal. Typically, if you get a deep blood clot in your leg, it could potentially go to your lung, which once again can be fatal. Persistent pain. Some people have knee replacement and it just continues to hurt. Stiffness, meaning patients not getting the range of motion back that they would like. And then wound complications, where the wound, we call it dehisces or comes apart. This can potentially be a major problem in that you would need some kind of grafting, a muscle flap, some kind of coverage of this area if you had too much soft tissue breakdown. Some people have even required amputations associated with this. After surgery, you want to follow what your surgeon tells you to do to the T. Once again, failure rates have been reported as high as 11% with those complications that I just went over. You do want to use your assistive devices. After surgery, I have a knee immobilizer on my patients to hold their knee straight and prevent it from buckling when they're up on it. I also start out with a walker to use in conjunction with the brace, and then I'll graduate to crutches and ultimately a cane. I'll get rid of the brace once they are able to do a straight leg raise, lifting the leg up out of the bed. To me, that tells me that their quadriceps muscles are working again and that they're strong enough to ambulate without the brace, but still with the assistive devices, the walker initially. I have had 2 patients in 17 years that didn't listen to me on the brace, walked on it without the brace. The knee buckled, they fell and landed on the knee, split open. They were back in the operating room for a washout and reclosure. I would plan on not driving for at least 6 weeks, particularly if it's the right knee. If you had to hit the brakes, that knee would be weak and you could run into some serious problems there. You want to avoid any heavy stuff, no heavy lifting, pushing, pulling. Blood thinners are important after knee replacement. Like I mentioned, there is a risk of blood clot. Varies from surgeon to surgeon what they recommend. There are injectables like Lovenox, prescription pills, and then just over-the-counter anticoagulants, aspirin in particular. That's the one that I currently prefer, and there is kind of a trend going towards aspirin. You don't have to monitor it. There's no injections, and it's cheaper because it's over-the-counter, not prescription. Also, you can continue it as long as you want. I recommend 3 months, but if you want to continue it longer, say 6 months, there's no harm in that, or very little risk. And I have had one patient that did develop a blood clot after the 3-month mark. Pain control is very important after knee replacement. This is probably the most painful procedure we do in orthopedics. Initially, we'll do an anesthetic block to numb the leg up. That lasts typically for the first 24 hours. Scheduled anti-inflammatories alternated with acetaminophen or Tylenol. You should continue this not only in the hospital but at home as well for as long as you need to. It helps with not only the pain but with swelling and inflammation. And then you'll have some kind of pain medication to take for breakthrough pain, possibly Lortab, Percocet. You do want to use your assisted devices. Not only do they help you walk, but they help you with your pain as they protect the knee. Once again, this includes the knee immobilizer, walker, crutches, cane. Icing is very important after surgery. I prefer a cryo cuff, which is like a bladder that wraps around the knee. Cold water runs through it and keeps the swelling down and helps with the pain. You should use that as much as you can. Physical therapy after knee replacement is extremely important. If you don't do your therapy, you're not going to get a good result. I start out with range of motion very first day after surgery. Currently, I prefer a device called ROM3. It's like a kind of a mix between a continuous passive motion machine and a stationary bike. It's fully adjustable as far as how much range and resistance, and it can be scaled up or down depending on the patient. There's both a device for the bed that you can use not only right after surgery in the hospital but also at home. And then there's a bigger device that can be used in physical therapy. And as you advance in your motion and strength, it can be adjusted upwards for a better range of motion and more resistance. This concludes the information I have on knee replacement. If you have any further questions, please do not hesitate to contact me at Assured Orthopedics of Kentucky. Thank you.